Hello viewers, so today we are continuing our congenital series, the congenital series in which there is problem in the children which is during the time of his birth. So what are the problem we can see at that time the child can have? Like there is a problem in the scapula bone. The problem is known as Sprengel deformity or congenital elevation of the scapula. So the scapula, this bone is normally present when the child is a embryo at this position. At the 5th week of gestation, the scapula position during the developmental period is at this position, C4, C5 level. And gradually over a period of 2-3 months, it descends down up to T3 level, which is a normal level of a scapula. So if this descent is disturbed because of some problem during the embryogenic phase or during the gestation period, so that child may have a Sprengel deformity in the shoulder, maybe the mild, moderate or severe. We will discuss later as per the deformity level. So how it will look like? The scapula will be high at the level, smaller in size and wide in shape, and as well as it is mal-rotated. So what is the reason? The reason is there is a sort of pulley which is present between the scapula, and once it is descending down from C4 to C5 position. So if that pulley or thing is disturbed, like fibrous band, cartilaginous or omovertebral parts are present between the scapula and the vertebral spinous process, so it's coming down like a pulley. So it is present in many of the cases, both sides, like around 10 to 30% in the cases. And if there is Sprengel deformity, there could be other possible problems as well, like the patient can have a cervical rib, the patient can have a klippel-feil syndrome, the patient can have other intraspinal problems. Those like in the central midline area, you can see there could be certain signs like the sinus could be there, the hairy patch in the lower back area, or the hemangioma can be present. So these things, if they are present, that means something is problematic in the spine. So Sprengel shoulder is not a one deformity. It can be associated, it can be present with other deformities as well. The specific shape of the scapula also changed. Normally the midline part of the scapula is longer part, but because of this disease, that longer part is equal to the other part, so it is like an equilateral triangle. The shape is disturbed, and the upper portion of the scapula, this portion is bent like this, and as this is bending anteriorly, so this part will have a connection with the ribs anteriorly present. It can articulate with that, and because of the malrotation, the scapula comes outward direction, and here the acromion process acts as a restraint that this movement is blocked if the position is like so. So these are the things. Also there are lots of muscle in this area. All those muscles like pectoralis major anteriorly, rhomboides major minor, trapezius, levator scapulae, serratus anterior, all muscles are dysplastic, not developed properly. So we used to make a diagnosis by we can see the movements. The movement is also restricted. The scapulothoracic movements are restricted. So we do classify these deformity in a classification named as Cavendish classification. The grade 1 is the mildest form of the Cavendish classification, and you even cannot diagnose because it is so mild. The difference is very low. So if the person is wearing some dress, you can't differentiate it is a scapular problem, the elevation is there, Sprengel deformity is there or not. If the deformity is a bit more, the second grade of Cavendish, then once you undress the patient, you can see that the level of both scapula are different. And if it is further more advanced stage, the Cavendish 3, there will be difference in the shoulder level. You can see even if the person is wearing clothes, you can see there is a shoulder difference of the height between 2 to 5 centimeter. And in the severe variety, the most severe variety, the upper part of the scapula, the topmost part of the scapula is almost as if it is touching the occiput part, that much high. So this is the most severe variety. So it is about now about the treatment part. The mild variety doesn't require any sort of treatment. The conservative treatment is suffice. There should be shoulder range of movement, and the surgery age has been defined in the 3 to 8 year of age. Normally there are different named procedure which is been prescribed or advised as a surgical procedure, like the Green's procedures. The basic of the procedure, as the deformity is milder and the age is between the 3 to 8 year, in those area you only need to dissect, soft tissue dissection, and you can descend the scapula to the normal position or almost normal position and then reattach the muscle. So this is in the Green's and Woodward procedure. In Green's procedure, you detach the muscles, paraspinal muscle which are attached over the scapula area. You detach all those muscles, descend the scapula down and reattach those muscles. This is Green's procedure. In Woodward procedure, you are not touching the paraspinal muscle which are attached over the scapula. You are removing the paraspinal attachment, the origin over the spinous process of the vertebra. So now you are detaching the vertebral part of the paraspinal muscle, and again the scapula descend down and you will reattach it. The modified procedure of the Woodward, in which you resect the superior pole of the scapula. Now the conditions or the severity of the surgery is increasing, because now you are doing some bony procedures, like you are resecting the superior pole of the scapula, and the scapula is coming down and you are aligning the scapula well in the position, then you reattach the things. Furthermore, in more advanced procedure, the Wilkinson's and Campbell vertical scapular osteotomy, you cut the scapula, you cut the clavicle, because once you are descending this scapula, there could be injuries in the nerves which are there in the brachial plexus and many other nerves which are around this area. So you do a clavicle osteotomy in older child. The very advanced procedure is the classic procedure, in which you do the osteotomy of the clavicle. You extensively release all the muscles around the scapula. You excise the superior pole of the scapula. You are repositioning the scapula to its position and the vertebral spinous process, and you are again reattaching all the procedures. So this is about, guys, the Sprengel deformity or congenital elevation of scapula. It's a problem which is present in the children when they are born with a congenital deformity. There could be other congenital problem as well. So we are continuing this series of congenital problems, although they are quite rare, but if they are present, so the parents and the treating team all will be worried about the things. So please like and subscribe for more updates, for more videos. Like and subscribe us. Thank you.